Okay, so while the wax is still warm, I'm going to try to pry this out. And it's resisting me quite a bit. In this area here, as I'm trying to pry it, you can see that it's changing shape. Probably because of the fact that it wasn't exposed to the light as much as the rest of it. So move on to another area. If you find that area being a little bit soft, move to another part of the periphery that you can use your instrument to pry it out without altering the shape of the tray. But I think for the most part, this is coming out rather nicely. Now I can grab it from the handle area and pry everything out. And you see what happened to the wax. It's done. So when you're doing your assignments, and you're doing 3 of them, you're probably gonna have to do 3 blockouts. The tissue stops. Let's look at the tissue stops here under this tray. They look nice and clean, but are they cured? I'm just gonna try to feel them out with my instrument. They feel cured, but they could be soft in some areas. So for that reason, we're gonna put this back in the curing unit for another 30 seconds, upside down, to make sure that we have thorough curing of the tissue stops as well as the rest of the periphery. But ensure not to put it back in with all the wax hanging off it, because the light source or the bulb inside the curing unit creates heat, and all this will create a mess inside the curing unit. The table over time will be filled with wax and being clean. So this part here, I can just simply peel it off. And eventually we'll have to boil off the remaining wax from the model on the lower as well as on the upper. One thing to keep in mind though, before you use any hot water to boil off that wax, whether it's from a kettle or a boil out unit, you have to ensure that the models are moist. So you have to soak the models for at least 5 minutes in a bowl of water. Otherwise, if they're completely dry, like these are, and you pour hot water on top of them, they'll crack because of the rapid thermal expansion that it creates.